Hi all, I'm Dr. Malati, working as a professor in Tripura College of Nursing. So in this video, I'm going to discuss about the contraction chart. So this is a chart as a nurses we use to maintain during the labor process. The objectives are introduction, definition, purposes, physiology of normal uterine contraction, characteristics of uterine contraction, assessment, the articles needed for maintaining the contraction chart, procedure, contraction chart, interpretation, nurse's responsibility, summary, and conclusion. Introduction. A contraction chart will provide a systematic record of the uterine contractions. It includes the frequency, duration, as well as the intensity of the contraction. So, accurate in observation and documentation helps to enable the early identification of abnormal labor patterns, and also it helps to allow the timely medical or nursing interventions. So it is an important component of the partograph, and also it helps to contribute the safe and effective intrapartum care. So nursing students should develop the knowledge and skills required to maintain the contraction chart accurately to ensure the quality maternal and neonatal outcome. This is a WHO modified partograph. So in this partograph, there is a one compartment denotes about the contraction. Definition: uterine contraction. It is a rhythmic tightening and relaxation of uterine muscles. So contraction chart is nothing but recording the frequency, duration, and intensity of the contraction. The purposes of maintaining the contraction chart helps to assess the labor progress, helps to detect the abnormal contractions, to prevent the prolonged labor, monitoring the oxytocin effectiveness, identifying the hyperstimulation of the uterus, ensure the maternal and fetal well-being. Physiology of normal uterine contractions are fundal dominance, polarity, involuntary. So fundal dominance, which is nothing but the contraction usually starts in the upper uterine segment, which is nothing but a pacemaker, and also it is considered as the strongest at the fundus. Polarity is nothing but it is a segment. The upper segment contracts and retracts while the lower segment will dilate the cervix. So this is a harmony between the upper and the lower uterine segment. Next, third one is involuntary. So they are involuntary and intermittent, and also it becomes more frequent and stronger as labor progresses. Characteristics of uterine contraction. So the frequency, if you see, it can be counted from the beginning of one contraction to the beginning of the next contraction. So it can be measured in minutes. So normal active labor, usually it will be 3 to 5 contractions can be felt by the mother during the labor process for the every 10 minutes. So coming on to the duration, the time lapsed from the beginning of the contraction to the end of the same contraction, that is measured in the seconds. Intensity, which is nothing but the strength of the contraction and its peak. The assessment of the uterine contractions can be observed with the help of the frequency, duration, intensity, maternal response, fetal heart rate, and resting period. Articles needed are partograph or else the contraction chart, watch with second hand, pen, gloves, Doppler, and fetal monitor. Procedure: explain the procedure to the patient, wash hands, position the mother comfortably in the supine positions or else in the left lateral positions, palpate the fundus and observe the contractions and record the findings. How to record a contraction chart? So record the number of contractions in 10 minutes, duration in seconds, and intensity. So WHO, according to the WHO partograph contraction recording, uterine contractions can be recorded every 30 minutes on the partograph. So there is a scale numbered from 1 to 5 contractions per 10 minutes. So each square represents one contraction, so that if two contractions are felt in 10 minutes, two squares need to be shaded. So on each shaded square, the duration of each contraction is entered by using a symbol. That is, so this contraction is divided into three main types: mild, moderate and severe. So when you say it is mild, means if the contraction felt between 0 to 20 seconds, you will call it as a mild contraction, and it has to be marked as a dot inside that square box. Coming on to the second type, that is moderate contraction. So if the contraction felt between 21 to 40 seconds, so that you will call it as a moderate contraction. So that you can mark it as a slanting lines in the square box. And the third type is a severe contraction. So it can be felt between 41 to 60 seconds. So that can be shaded completely. That square box should be shaded completely. So that is called as a severe contraction. So this is how you are supposed to represent in the contraction chart in the partograph. So this is a component which comes under the partograph. You can able to see the five boxes, square boxes inside each lines. So how many number of, usually for the 10 to 15 minutes, okay, the mother will be having around 2 to 5 contractions. So based on the each contraction type, you are supposed to shade it inside the square box. Interpretation: normal means 3 to 5 contractions per 10 minutes and 40 to 60 seconds. Severe contraction, the mother can be felt. Abnormal means weak, hyperstimulation, tetanic or prolonged contractions will be felt by the mother. Nurses' responsibilities are assess regularly the contractions, record accurately. Meanwhile, we are supposed to monitor the fetal heart rate, observe the mother, report if you have noticed any abnormalities, and provide the emotional support to the mother. Complications are maternal exhaustion, uterine rupture, and PPH. For fetal side, hypoxia, fetal distress, and birth trauma. So these are the complications may develop for the mother as well as for the fetus. Advantages of contraction chart are early detection of complication, better decision can be taken for the better maternal and fetal outcome, preventing the prolonged labor and improve the outcomes. Summary: a contraction chart is a valuable tool used to monitor the uterine contraction throughout the labor. It records the frequency, duration, and intensity of contractions at regular intervals. It also helps the healthcare professionals to evaluate the progress of labor and to detect any abnormalities. So, proper maintenance of the chart supports clinical decision making. It improves the communication among the healthcare team, and also it ensures the timely interventions whenever necessary. Accurate documentation reflects professional nursing practice, and also it promotes the safety and well-being of both the mother and the newborn. Conclusion: the maintenance of a contraction chart during labor is a vital aspect of obstetric nursing care. It enables continuous assessment of labor progress, early detection of the complication, and prompt management to prevent the adverse maternal and fetal outcomes. A well-maintained contraction chart enhances patient safety, supports evidence-based nursing practice, and facilitates the effective communication within the healthcare team. Therefore, BSc nursing students should acquire competency in observing, recording, and interpreting the uterine contraction as an integral part of comprehensive intrapartum care. References. Thank you.